My name is Thomas Ostermann. I'm a professor of research methodology and statistics, and I'm working at Witten-Herdecke University, Germany. And I'm in the field of integrative medicine for many years now, beginning at the late 1990s. Yeah, well, my presentation at the conference was about cost-effectiveness studies. So we have already talked about effects, for example, of a treatment, of inpatient treatment, but the effect is only one side. So the second area is, what are the costs related to these effects, and is it cost effective? And this is something very important for decision makers and stakeholders, health policy experts, because they want to know what works at least costs. So in the study I presented in my talk, we did a modeling approach, and we wanted to know whether an additional treatment with a homeopathic remedy would be cost effective in terms of avoiding acute throat infections in children and in adults who are suffering on upper respiratory tract infections. So this is a highly interesting topic for society, because many people suffer on that, and the idea is to reduce the costs, probably also reduce surgery, tonsillectomies, for example. And the question is it possible? And we did a modeling approach, and we found that, in fact, for children, the additional treatment with this remedy is cost effective. Many studies and surveys reveal that patients are really using homeopathy, and they have good experience with homeopathy. So therefore, I would say, in the sense of a definition of evidence-based medicine, which includes the patient's perspective, it's not a waste of money. But there should be more studies which have the idea to look at the effects and, of course, the costs. So therefore, that the patient side is only one side. And therefore, the scientific community needs to give more evidence on this topic. So patients experience that it works. Okay, that's for sure. But this doesn't give us the chance not to do any research, but it is the obligation to do research. And this is probably the most important thing. If patients believe that homeopathy works, the scientific community should do everything to prove it in high-quality studies. And they should be honest in their results. So if it doesn't work in some conditions, well, it doesn't work. So this is something which is also kind of reflection on the idea that patients say it works, then science has to deliver the facts.